Good morning, everybody, and welcome to this meeting of Adult Care Health and Wellbeing Cabinet Panel. We're in a different room today, so do bear with us with slightly different arrangements. So I need to read out this announcement. So, webcasting. This meeting of the Adult Care Health and Wellbeing Cabinet Panel will be filmed and webcast live on the internet. It will also be recorded and published on the Council's website. All parts of the room can be seen or heard by the camera or microphones. Any members of the press and public present in the room at any time during the meeting are likely to be included in the webcast and recording. In terms of membership changes for today's meeting, Michael Muir is substituting for Richard Fay for this meeting only. Dean Hart is substituting for Connie Hearn for this meeting only. Chris Lloyd is substituting for Sarah Bedford for this meeting only. There are no apologies. So I just need to read out an item on members' interest. So a reminder of the disclosure of interest or any declarable interest, then I'd like to pay. But also, members are advised that in respect of the debate concerning the Council's integrated plan, including the setting of the Council Precinct, the Standards Committee has exercised its power to grant a dispensation to all Hertfordshire County councillors for the requirement to declare any disposable pecuniary interest or declarable interest. Accordingly, there is no requirement for any councillor to make any declaration of interest in respect of this item of business. Members are reminded that Section 106 of the Local Government Finance Act of 1992 provides that if a member is in arrears of council tax for 2 months or more, they are present at a meeting where the council's budget or the precept is being considered, and they should declare this, and any such member must not vote on any matter relating to the setting of the council's budget or the precept. The provisions of Section 106 of the Local Government Finance Act 1992 apply even if there is an arrangement to pay off the arrears. So moving on to the business of the meeting. Item 1 is the so I'm inviting the panel to agree the minutes of the meeting of the Adult Care Health and Wellbeing Cabinet Panel on the 16th of November. Is everyone happy with that? Thanks very much. Item 2, public petitions. None have been received to date. So moving on to one of the main items of business. Item 3 is the integrated plan 24-25, 27-28 in terms of adult care, health and wellbeing. I'm passing over to Jackie with the presentation. Thank you, Jackie.
Can you hear me? Can you hear me? Okay. So I'm here to introduce the Adult Care Health and Wellbeing Integrated Plan from 2024-25 to 2027-28, which is set out in detail in the Integrated Plan pages 62 to 89. The Adult Care and Health and Wellbeing Integrated Plan is closely linked to the delivery of our 4-year ACS strategic plan and supports the key strategic themes of the Council of health, being and living lives for our residents. The key priorities outlined in the plan are the investment in care workforce and proposed £31 million investment to ensure that adult care providers continue to support residents and includes uplift the care worker pay. This builds on significant investment over the last few years in Hertfordshire and recognises how much we value our care staff. The proposed investment takes the total investment in care providers to over 125 million since 2019-20. The budget also includes just over 17 million to support increased numbers of older people with disabilities and adult mental health needs who need our support. There are a number of key challenges outlined in the integrated plan. The first one being the supply of quality care workforce. That remains a key focus for us. And even with the significant care provider fees, it remains challenging to recruit, particularly in high-cost areas where there is intense competition in the labour market. The second key challenge is the demand for services. We're seeing increases in numbers of referrals, assessments, hospital discharges and safeguarding. They're all rising and present a challenge in terms of sufficient council workforce to manage demand and puts pressure on our care purchasing budgets. This pressure is reflected in significant investment in demography, 17 million that I've already referred to, That is why our Connecting Prevent Investment and Prevention Programme is so important. Third key challenge I'd like to highlight is the nursing home provision. As the complexity of people being supported increases, our nursing home provision is under significant pressure, particularly in relation to people with dementia. And this is why through our proposals there are higher uplifts for this sector included in the 31 million investment. Key projects for us over the integrated plan project period. We're continuing to support more people, both working age adults with disability and older people in their own homes, whether it be through the help of assistive technology, home care, or through supported living arrangements. The investment in prevention has been protected in the integrated plan, and we continue to develop our Connected Prevent programme to help us to manage the increasing demand for services by supporting more people to remain independently for longer and reduce their need for long-term care. That's an overall summary of the very detailed integrated plan, and I welcome your reflections and any comments.
Thank you, Kelly. And obviously, there was a scrutiny we discussed in the slide of the month. Sally.
Well, thank you very much. Thank you for that report. Actually, you said you're going to be discussing the scrutiny later.
No, maybe we've discussed scrutiny, but we've got council meeting to be budget.
So in that case, I'm going to ask the questions.
Yeah, please.
So firstly, just to say, obviously this is an very commercial area, and the scrutiny process has devoted only 1 hour to it. And that as somebody who wasn't, and neither Chris Cullen nor I were on the panel, none of us have actually seen the recommendations that have come forward from it. So as a first one, can those be shared with us and anyone else in this room? You can see them. Because I think that's really important to start, and obviously determines how long we will spend in this meeting discussing the rest of it.
Yeah, obviously, I didn't realise you hadn't seen. Obviously, they went to the panel members, to the scrutiny panel members. I'm sure we can share them now. But you might have to look at it. I wasn't aware of that, but thanks for raising that.
Okay, so thank you. So just really to set out, as I said, I think this is a huge budget area. I know it's had scrutiny, but it's very little time. I guess if I was going to ask for one thing, obviously one of the big changes that has occurred since this report was written is that the government scale to has made a grant for which there is an apportion, which is around 8 million for the adult and children's services. So I wondered if we could have some detail in how that money is going to be allocated, the split between adults and children's, and how far the determination is going and how it's going to be allocated in action.
Yeah, thanks, Sally. Yeah, we had an unusually late addition to the local government finance section of forming of the 500 million for social care grants, which usually really impacts adults and children. We are yet to know the exact figure what we're going to get, and as such, decisions haven't yet been taken on how that will be applied. I would reference the inherent risks facing both adults and children's. Less knowledgeable about children's services, I understand, in terms of demand and unit cost issues. So when those decisions are made, those decisions will be made ahead of decisions at council that were but haven't been made yet because we haven't got the figures in yet. We will have to bear in mind the risks around both price and volume and demography in making those decisions, and look at that in not just in terms of this year but future years too, in terms of the medium term sustainability of the particular care budgets. Jackie, want to say anything more?
No, it's just we haven't got the detail of the grant and the sort of regulations around it, so we're just waiting for that.
So can we just have on that? Will we have what are the timelines on that? Will that come forward before take us to full council?
Absolutely.
Yeah, my understanding is yes, because it will form part of the overall budget for the next year. So what I don't know exactly whether we'll get the detail from the last map that this year.
No, as you said, it's really unusual to get a late settlement now from its first one since 2016. So we are hoping that it comes in early February, but as yet we're still waiting.
I remind members that soliciting West Room, so people to use the microphone, it's very easy to, I think we share it, so just to remind people that it's not being picked up in quite the same way. Sally, was that?
Yeah, I'm happy to. Yeah, I'm happy to let others ask questions and come back later and just
So I've got the only guest, then Chris Lloyd. Yeah.
Yeah. Thank you, Chairman. Yeah, sorry, I couldn't be with you, but I got a message from Sally late yesterday afternoon, and I was in meetings all day yesterday, and I did need time to read the papers. So, and I had something else on first thing this morning. But my questions are basically on the introduction. I'm not going to rehash what was done in the IP that we haven't got the paper for, but I think if I'm correct, because the sound is difficult for me to hear, and it's probably difficult for you to hear me, but recruitment seemed to be a challenge. So what are we doing about recruitment? And equally well, this is also one of the other challenges and risks. I think you mentioned that the number of people being referred is increasing. So I think for me, there's a very strong linkage to public health, because we need to really be looking at people and their lifestyles. Otherwise, if we're looking 20, 30 years down the line, both with what you're doing in your team, Chris, and what the health service are doing, we're getting ourselves into unsustainable positions. So I think this, what the officers have already done with the budgets they've got, they should be commended. But looking at the budget challenges coming up, I think the task ahead, not just this year, but particularly the year after, is going to be very challenging for all of us as council. So that's all I wanted to say at this stage, Chairman. Thank you.
Thank you, Chris. I think there's some key comments there. I don't know if officers want to come back on the recruitment side. Obviously, there are things in the IP about that.
I'll do prevention, and Jack, you do recruitment with that one. Also, we've got to listen to people. So on prevention, Chris, yeah, absolutely right. There's issues short-term prevention and long-term prevention. We're really lucky we've got a really productive relationship with the Director of Public Health and Public Health Department. For example, investment in things like falls prevention services, which is kind of really important. Investment to prevent people, for example, having an injurious fall and then requiring both NHS and social care as a result. In the medium to longer term, clearly our efficiency savings requirements increase, as you pointed out, Chris. Crucial to that would be delivering a really targeted and relentless preventative programme across all individual groups that we support. A number of people already, think of the demographic pressure and immediately focus on an ageing population, which of course is a pressure, but a more significant demographic pressure is the increased life expectancy of individuals with learning disability, which of course is to be welcome, but increases significant financial costs on the council. So it's absolutely vital that we get the right level of support that maximises people's independence as early as possible, including, and this came up in the discussion in scrutiny, including really close working with children's services around transitions, which is an important part of that. And then Jackie on workforce.
Yes, thank you. So in terms of workforce, that's why we've been so keen to support the investment in sort of care worker pay and making sure that pay rates for care work in Hertfordshire is attractive, and the statement this year and in previous years maintains pay rates above not only the national living wage, significantly above the national living wage for home care, but also above the living wage in terms of that rate. We keep a close eye on the vacancy rates across the care sector. Slightly, we're sort of in line with national figures, and the current vacancy rate shown in the latest skills for care data suggests a vacancy rate of 9%, which is down from 10.9% the previous year, and equates to 2,800 vacant posts. And the number of filled posts have gone up by about 1 percentage point since 21-22, but we're obviously aware that this data, when it gets presented, is not necessarily a current reflection. And we are constantly talking to our care providers, making sure that we keep constantly monitoring the impact. In terms of home care, it's fair to say that the capacity in terms of providers being able to support us in delivering home care has increased dramatically over the last year, with people waiting going down from around 300 just over a year ago to currently last week about 12 people waiting. So we're monitoring the impact of the market constantly and talking to providers all the time in terms of monitoring vacancy rates in the care market, and also working through that. We're looking at our own workforce as well and making sure that we keep monitoring the vacancy rates and the impact that the different areas of the labour market are having. But it's an area of keen interest for us in terms of keeping up.
Thank you, Jackie. I've got hands up to speak, but given the question about scrutiny, and it's not that long, shall I read out scrutiny recommendations which we discussed last Friday? So from the scrutiny, assisted technology development and its rollout will align to deliver anticipated savings. Second one, sufficient provision is made for those that are digitally excluded to ensure all parts of the community are informed and fully engaged. Thirdly, that the impact of users with challenging needs transitioning from children's services to adult care services is factored into the modelling of demographic change with its possible impact on the ACF budget. The last recommendation, further work is undertaken to understand the impact of reduction in mortality budgets on communities, voluntary sector partners and ACHW services. So I've got Fiona Guest and then Nigel.
Thank you, Chair. We've got a few questions here. Again, we're increasing the funding to care providers to increase care worker pay. How has providers monitored to ensure that they do pass the funding for pay onto the care workers? That's the first question.
Thank you, that's Chris.
Yeah, thanks, Fiona. A couple of ways. Often one of the things we do is we ask them and clear what they are. That's the first thing we do where people are signing up to our big contracts. We're prescriptive about that. The other way we do that is we keep monitoring job sites and the internet because it's very clear what those wages are. The other tool we have to do this is obviously through our local authority trade company. We have indirectly, but a controlling stake in a care company, and we are able to understand wages that they set and the impact that has. And finally, I'd say it is a competitive market, so people who may not be paying sufficient amounts of money will not be competitive with those that we know are. We know those, we do know that we pay sufficiently for those wage rates to be paid. If we do a lot of calculation behind that, and ultimately the market will move people to work for areas where they will get paid better salary. So that's how we do it. We don't have direct control because we don't, with 95% of the services, we don't deliver them ourselves, but we influence and contract the mechanisms we can to ensure as much money as possible goes to those categories.
It's a very important question. It's very important. Yeah, you've got that question.
Yes, I have. There wasn't time to discuss this at the IB's meeting, but there are anecdotal reports. One of the barriers to becoming care workers is childcare provision. So, how are we able to overcome that barrier?
I'll take that one because I'm looking at the more recent experience. So number one on that one, clearly that is an issue. It's not something that we directly control. I think clearly that the more we can pay good wage rates the more likely it is people are going to work when they have childcare arrangements, because clearly there's a cost decision that families have to make about, is it worth working in terms of the wages they receive versus the potential cost of childcare, and the key underlying wage rate is crucial for that decision. Secondly, there's clearly a set of national policies emerging on extending free childcare hours to 2-year-olds and over. That is being implemented as we speak, and I know colleagues in children's services have responsibility for that early years workforce and implementing the government's policy in those areas. I will make no comment on anything around that policy. It's not my area of expertise. One reflection I would make there is one of the tensions actually in this is that the workforce for adult social care and for early years is potentially the same people. So actually there's a balance there between the competitiveness of the early years workforce. Does one of those, does that becoming more attractive, potentially taken from the adult care workforce and vice versa? So whenever we're making investments in certain aspects of the workforce, we have to acknowledge that we are still pulling funds at limited pool, so to speak, and we need to understand the relationship between investment in one area and the impact on the other.
Thank you.
Thank you. I've got Nigel next. Thank you, Jen. And I'm also a case on record my concern that now overjoyed. That's not responsibility. You've got that there. And obviously that hopefully we'll get the details on the 8 million. That's what it is. As soon as possible within 3 days. I hear and what Jackie's laid out, and obviously the director. So it's welcome the emphasis as last year. Administration and having to support the emphasis on pay, especially for our carers now. And kids do feel like, so that is important to see if you've got enough there. But I just wanted to say, obviously, you have all the budget, our own views on that, but will we be able, just the director think that what we've got for the next 12 months, taking into account this, because it will be tough. Are you confident that what you're willing to deal with is about 8 million? You will be able to still be able to produce and have an efficient good service as I've been got for the next 12 months. How confident are you what's in this budget?
So I'm confident that given the financial constraints facing local government, facing the wider sector, I'm number one, I am confident that this represents a fair deal for adult care within the kind of overall budget that the council has. Is that sufficient to do everything we would want? Well, I think everyone in adult care nationally would say that that's still insufficient, and there needs to be a different resource allocation nationally within that. However, I am confident that this budget will allow us to fulfil our care act duties to the level that we have previously. Now, am I 100% confident? Well, no, because the world is a volatile place, particularly as it relates to inflationary shocks, Nigel, and the volatility of things like workforce. So it would be naive of me, and I think probably disingenuous to say I'm wholly confident about things because I don't know what's going to transpire. But with what I know now, I think this is a fair budget for adult care services, and we have done everything we can to protect frontline services. I'm really pleased that we protected the £60 million investment in the voluntary community sector, which relates to the points around prevention earlier, and being able to deliver what I think is a fair inflationary offer, albeit we have to consider that every year, certainly over the last 3 years, the inflationary offer for care providers is probably the biggest single item in the integrated plan in terms of expenditure, just given the size of the adult care budgets. So I am as confident as I can be, and I believe this is a fair settlement for adult care services. But that does not mean I don't think there are wider issues around the overall sustainability of adult care governments nationally and locally.
Thank you. Thank you. You're right. I mean, it is worth saying that a major part of the budget is very long into care providers, and as Jackie said, 125 million since 2020. I've got Calvin and then Chris. Chris, have you got your hand up again? I'll assume you want to speak, but it's Calvin.
Yes, thank you. I don't want to go into the issues around the care centre and recruitment there, but I have got some concerns with the connected events, particularly within the intern as well, because that does depend on us having the social and the occupational therapy stuff in particular, that being able to do that preventive work. So the question would be, how confident are we that we're going to be able to recruit and retain the staff internally, the social workers and occupational therapists in particular, so that we can deliver what is a very important, not only for our people we're serving, but also for our budget.
So, yeah, Captain, actually, right, there's two recruitment issues. There's a wider care market, which is not part of the money spent, and then there's the internal staff really in adult care services, which totals about 2,300, including the income services, social workers and occupational therapists, but also learning disability nurses, which we shouldn't forget are areas where there are national shortages of those roles. So I am, I can't say that I go in confidently that we'll always get the number that we want, because there's an inherent supply issue. What I am pleased with is that we have a renewed focus on recruitment and retention in those roles. We have seen turnover reduced. That's partly because we've got a program board for the operation centre holding Helen and the director of HR, which is really helpful selling. But there's a couple of things that I think we're trying to really focus on, which is to say, well, actually, growing our own, so to speak, we think is most important. So just today, actually, I got an email saying that our apprenticeship scheme for occupational therapists, which have been in place for 2 or 3 years, I think. So again, we're looking to expand the numbers there still in social work and nursing apprenticeships too. So there's that work around it internally, as well as continued working around our recruitment campaign, which is now kind of ongoing and always open. Make changes to pay and conditions in the future workforce. And ultimately, on the basis, this is my responsibility. We have to create a culture within the department that recognises the importance of professional development, effective caseloads, and crucially, a training and development offer that supports individuals to develop their practice and their skill set, which we know above everything else is important to attention, to make sure people feel equipped to deal with what are clearly set challenges that are very dynamic and changing. We'll make sure people are supported. And I'm particularly proud actually of our learning and development offer for our workforce within adult care services. And it's really important that we do everything we can to protect that, but also just create a culture that is a positive one for professionals working with those with one. Chris.
Yeah, my question relates back to the 2,800 vacancies, which, if I listen correctly, and it's incredibly difficult, it's far more difficult than being on remote in the council chamber, but the there's a drop from 10% to 9%, so I think that's good news. But obviously, from a budget point of view, there must be some money which is getting rolled over if we haven't used all that staff. And you touched on, Chris, that obviously you're training people and their skills. So how has the turnover compared? Because obviously part of our budget needs to be invested when people join. And I'm concerned, obviously, that the workloads, as you mentioned, are still high and that you're looking to do things. But what's the well-being of the staff? And a measure of measuring that, has our turnover rate dropped compared to the previous year?
Chris.
Yeah, thanks, Chris. So the number you referenced there is the 2,000 is the vacancies within the wider care workforce. We don't see a direct relationship to the number of vacancies and the care purchasing budget, because partly it depends where your vacancies are. So if we've reduced, or we think we have, the vacancies in the home care sector, because we've seen that waiting list reduce, and we've made purposeful investments over and above inflation in the home care sector over the last 3 years, that supports people, you know, actually in a way that they would prefer, i.e. in their own home, but it's also relatively cheaper for us than supporting individuals in a residential or nursing placement. So the vacancy rate in the overall sector doesn't have a direct relationship with our budget in the same way as you might think. The only exception to that, Chris, is where our in-house services, which is our supported living day service, where we're delivering CQC registered services ourselves. That vacancy rate is higher, but again, if that vacancy rate comes down, we may rely less on agency staff, which actually again is more expensive than permanent recruitment. So generally, my view is if you reduce the vacancy rate, you'll get a more optimal allocation of care to people that meets their desires and their needs in our practice model, and you reduce agency spend, so the financial sustainability of it improves overall, and that might seem counterintuitive. But I don't think it is when we look at it. And in terms of welfare and health wellbeing, Jackie?
Yes, thanks. So in terms of wellbeing, there are a number of strands in terms of our response to our internal staff, which I think was your question. So a regular part of the monthly supervision meetings and the overall performance sort of meetings that we have with staff covers both the wellbeing of individuals, and there's a particular section as in questions and the discussion had, but also the wellbeing of people's teams. So thinking about what's going on in the team, focusing, making sure that conversation that happens regularly focuses not only on tasks and things that need to be done, but also make sure that we pick up on that sort of wellbeing issue. I think it's fair to say that through COVID, we've had an even enhanced focus on wellbeing for staff and made sure that we had regular support, and that we signal that both through the ACS news and through supervision and people's conversations with their managers, and have wellbeing champions in teams. But also that's an area that we're focusing on with the ACS People programme, which Chris referred to, which is a whole suite of work that we're looking at across ACS in terms of recruitment and retention. We're looking at that sort of wellbeing and what else can we do, what else does staff welcome in terms of making sure that we are responding to issues, but also making sure that people feel valued and have an opportunity to share any issues that are going on in terms of their wellbeing. There are a number of things that are highlighted with sort of team picnics in terms of things that people can do, trying to make sure that we're really keeping that a live conversation and making sure it's dynamic and responding to people's well-being, making sure it's not just a static response.
Thank you, Chairman. I'm happy with the answers. Thank you very much. They were comprehensive and clear, so thank you.
Thank you, Chris. Any
I'll be drawing this to a close because I'd like to make.
Yeah, of course, yeah. Sorry. Anyone else? Anyone else want to comment?
Yeah. Thank you very much. Well, just got a couple. I really want to make a point. Actually, I'll make a recommendation as well. That we. So just before I propose that, I just wanted to link what I'm going to say to two things. One is that in 4.3, you obviously itemise inflation pressures, other pressures, efficiencies, and then we have a line for policy choices. So we have just under £400,000 worth of policy choices in a nearly £500 million budget. Obviously, everything ultimately is touched upon in the policy choice. So in itemising these at such a low level, is that because we feel that effectively this is all controlled by central government and there is no flexibility, or there's been a choice to not actually make any changes to policy? But I also want to link that because my second part of the question is obviously the use of reserves. So the report says that the proposal is to use 37 million worth of reserves over the next 2 years to fund the service. that's brilliant that we need to be funding it, but actually that's only a short-term fix. We've effectively been filled by aid potentially depending on how you're going to propose the aid is used. But there is an £8 million amount, give or take, and I know that's not a nice figure, and it's also not necessarily all for adult services anymore. But that doesn't fill the gap. So my question is, what is the sustainability of all of this longer term and after 2 years? How's that going to be funded? Because last minute amounts from the central government don't help us. And to do, which is why it links back to the policy choices. Are your choices limited by central government as well? And if so, how will you square that circle? So that's what I wanted to ask, and I want to make a recommendation that we address the add to the recommendations that the amount, whatever it is, let's say million, the proposals of the report before the council for us to see.
Thanks, Ali. Chris, maybe you want to come in and sum
Yeah.
up.
I'll do it. I'll work with Jackie on just if I've got something wrong, Jackie, on the understanding of the reserves, then correct me. But the first one on policy choices, yes, it's a relatively small amount. A lot of that relates, I think, to the currency budgets and stuff. But yes, so broadly, where we've been able to protect a number of what I would call discretionary services that we deliver over and above the Care Act, particularly around prevention, albeit there is a preventative duty under the Care Act, but it's not very prescriptive about how we do that. In terms of sort of policy wiggle room that you have as a director of adult care, it's relatively limited in the sense that you have to deliver the Care Act and you have to be cognizant of the Mental Capacity Act and all sorts of other legislative underpinning. But of course, there are very different ways of delivering that. So it's often less a policy choice and more a issue of delivery and what your commissioning pattern is to deliver that. But what we haven't done is, for example, said we're going to reduce everything or things like that. The Care Act is not able to do that. What I think the budget does do this year, it enables us to maintain the broad pattern of commission services that we have used to deliver those Care Act duties, and with what we think is as good an inflationary offer to sustain that market and vibrancy we would like to do that. Hence, you have not seen a lot of policy choices developing later on. The locality budget is not very in the orbit of my statutory responsibility. And then, secondly, on reserves, the numbers you put on reserves are those not just adult care for the whole household. So of which adult care is about half the budget. So they're not all related to adult care pressures. They're related to that. Yes, there is a balance always between the here and now and maintaining services and what the medium-term sustainable financial position is. As you will see in the integrated plan in the section 151 officer, Stephen Pillsbury, Director of Finance, has made a statement about his analysis of the budget. And he, like all of us, are clear in his basic finance. You cannot keep using one-off money to pay for all current services. He has deemed that the level of use of reserves is prudent for now, but will not be sustainable in the longer run. It is also important that you use reserves in a targeted way to make up for issues where there are, the so-called rainy day and allow time to make bigger decisions. So, for example, in adult care, we have a set of savings proposals that are significant to try and reduce the pressures on the overall council budget and therefore on reserves. Those are not things you can do overnight, because what you end up doing then is making quite reactionary decisions that may miss the preventative point but hit a short-term target. And I think the Director of Finance here, in my view, is the use of reserves is currently sustainable because it allows us time to deliver sustainable, connect and prevent sustainable efficiency plans, which we have a bit more of an impact. with that sustainability in the medium term. I mean, that would be my view on it. I am clearly both the director of adult care and a member of the senior management board of the council, and I must have a mind to the overall sustainability of the council budget, not simply discharge of the adult care duties. I have to balance both of those things and continue to see those.
That help you, Sally?
Thank you very much for that answer. That's great.
In terms, I believe in terms of this, the minutes taken, this will go forward to cabinet. So I think the comments you've made would be going forward in those minutes anyway. So I don't think we can comment as either Chris or us as ACS to say what's happening today. It's a wider issue as well, I guess, in those children. So but we can capture that recommendation and that will go to the cabinet.
Okay, well, I'd like to propose that we have an additional recommendation that we vote separately on that. Recommendation is that the cabinet is that a plan is brought forward before the council as to how the payment.
I mean, I can't comment on what's happening in terms of communication. But I would have thought, worst case, that would be published in the council papers that come out and pass the council. Chris.
On that, I'm just not yet clear on the timetable yet, but what I might suggest is we perhaps move on to another item. I just don't know the answer on the timing, but I perhaps can make some inquiries now to understand what we think the timing will be, so that I can give you that sense if I can now at this meeting. I just don't have it quite to hand, but I could then perhaps go and find out. If I can't find out, I can't find out. But if I find do that, that might help. But when you say before the council, you mean as part of the integrated plan payments that go towards the council? Okay, I'll find out. If that's okay, check right now.
Presumably it must be in the council.
I've thought so. I'll check. Yeah.
No, I'm sure.
Yeah, I'm sure that's the implication. I'm sure the council media not calling this a fantastic. Fantastic.
Yeah.
It's just, but if it wasn't going to be sorted in time for the, I mean, 2 weeks there, it's like one.
No, I can't do that. I wasn't suggesting it wasn't. I just haven't got the information to hand. Whether we will be.
I think we need for councils. District. That's the one.
I'll get the absolute confirmation. I don't like to confirm these things without checking with the finance. No, I mean, that's my understanding. I'll double check.
We need to go through. We need to get to the end of this answer.
Yeah.
Are you happy that that's noted, Sally, and then we'll get an update?
Okay.
We'll get an update in this meeting potentially. So if there are no more questions on this item, the recommendation is that Council is invited to note and comment on the content and to recommend to Cabinet proposals relating to the integrated plan in respect of adult care, health and wellbeing. The second one, the panel is also asked to identify any issues that it feels the Cabinet should consider in finalising the integrated plan proposal we discussed today. Is everyone happy with that? Okay, thank you.
I'm staying on this.
Oh, sorry. Yeah, thank three abstentions. And Chris. You abstaining, Chris? Can you confirm?
I'm assuming that's what Sally said she was doing, so
Yes,
I will do it. It's difficult to concentrate. I am trying to be with you, and so yeah.
Should we just be clear on this? The recommendations I've just said, can I have those in favour to raise their hands? Those abstaining, please raise your hands. Chris, are you abstaining? And I think that's everyone voted, therefore we've got the minutes. Just want to make sure it was undissenting. Thank you. So moving on to item 4, which is support and services update for victims of domestic abuse and other forms of abuse which disproportionately affect women and girls in Hertfordshire. And I'm passing over to Helen and Katie. I don't know who's picking up first. You Helen.
Katie's with you. in the room, so she's going to share her slides. But it's great to see Councillor Lloyd change your background, and to see you in your white ribbon is absolutely fantastic. So that's brilliant. And it is very difficult to hear, I will confirm that, but I can see, and it's great to see your background. Well done.
I hope everyone, that's nothing very good. I hope everybody online can hear me as well, and the slides are now being shared. So my presentation is twofold today. One is more of a partnership strategic update on county-wide multi-agency response to domestic abuse and other forms of violence against women and girls. And then the second half is around more of the commissioning that our team within adult care services leads, again, in partnership with many other agencies that so over the course of the last 10 more years, we've had a number of strategies in relation to domestic abuse. So the first county-wide strategy was launched in 2012 and has been updated twice since, once in 2016 and then again in 2022. So the overarching priority of each strategy has been generally quite similar, focusing on preventing as much abuse as we can, but also supporting where abuse has occurred and to prevent that escalation, and making sure that we have support both victims and perpetrators of domestic abuse. Our most recent strategy was launched in 2023 following the introduction of the Domestic Abuse Act in 2021, which introduced a number of duties for Tier 1 local authorities, including the provision of support and safe accommodation, so that includes refuge, and also for a multi-agency partnership board to be convened to coordinate the response to domestic abuse. So our most recent strategy was we had to include and focus on that statutory and that provision of support and safe accommodation. We know that about 70% of it require support in the community rather than in safe accommodation. So our strategy, as it stands at the moment, goes beyond that statutory requirement and also focusing on how we create a coordinated community response, which is the best practice model for responding to domestic abuse. So our statement with mission statement within the strategy is partnership with faith-based individuals and families where domestic abuse is not tolerated, and where it does happen, those experiencing or causing harm have access to the support they need to be free from or stop using abusive behaviour and to recover from its traumatic impact. So quite a statement there, but everybody is very much working towards that. So that strategy is governed and delivered through a multi-agency governance structure, which I'll just quickly take you through to give this an overview. So at the top we have our executive board, which is chaired by the Executive Director of Children's Services, Fisher, and that board sets the vision and strategic objectives and ultimately have accountability for that local strategy, making sure partners working together the best possible way. And the Vice Chair of that group is the Chief Executive Officer for the Office of Police Commissioner in Hertfordshire. Underneath that, we have a partnership board which translates those strategic objectives into operation, making sure that activity is coordinated across various subgroups that you can see underneath that, and that is chaired by a partnership secretary and again the Office of. So then there are multiple subgroups, each with a different focus. Our quality, innovation and commissioning subgroup makes sure that we have good quality services for victims and survivors of domestic abuse, and identifying those gaps in provision and working out ways to fill those through commissioning activity. Our risk management subgroup, which is chaired by the constabulary, focuses on perpetrators of domestic abuse. How can we identify those at the earliest possible point, prevent harm from being caused, and manage particularly serial and high-risk perpetrators through an effective multi-agency response. We then have our practice and partnerships network, which is where our providers have the opportunity to come together and talk about what they see as they are supporting victims and survivors, trying to keep them safe. We need to really hear from the ground what are the trends, what are we seeing, what are the aggravating factors, where are our gaps in support. We need to hear from them as to what is actually happening, and that informs our commissioning. Underpinning all of these, we have a co-production panel. These are Hertfordshire survivors who participated in a consultation in 2021 about what their experience is going to be like in Hertfordshire, where their needs met, and they now help us and challenge us in terms of our service delivery, our service design, making sure that we are responding in the best possible way. And then I'd like to draw your attention to this new subgroup here. Apologies, and this is a new subgroup as our partnership and our governance structure recently expanded to include all forms of violence against women and girls. So domestic abuse is one form of violence against women and girls. It is the statistically most prevalent. I think it makes between 60 and 70% of those that you have of violence against women and girls. But we know that the root causes of all forms of violence against women and girls are very similar, or in most cases the same. So to make an effective response to domestic abuse, we actually need to be focusing on all forms of law and preventing that and challenging some of those attitudes around women and men and gender, very complex things, of course, but making sure that we focus on everything. So as I mentioned, we have our domestic abuse strategy here, which runs until 2025. But this broad subgroup has been established to think, okay, we have that, long-standing history of domestic abuse strategy. We're very clear on what we need to do, how we're going to do it, but what do we need to do in terms of law? We need to get that real strategic, really clear across the agencies in partnership with the really lots of police and crime commission, health department, voluntary sector, and of course our co-reduction plan. So this group over the next 12 to 18 months will be looking at that strategy and working out what is the best way we can work together to tackle all forms of violence against women and girls. I just want to quickly touch on men in the context of violence against women and girls. This is a question we get asked a lot, and it's a totally valid question, and it's a good question. When we say violence against women and girls, that language, can make it seem as though men and boys are not recognised as victims. These types of crimes that encompass that violence against women and girls is law umbrella. And the reason that it is called violence against women and girls is because offenders of these crimes are disproportionately male and victims are disproportionately female. But this does not mean that men and boys can't be victims of these offences, the different forms of abuse that fall under the form umbrella. All the women can't perpetrate them, but the reason that we use the language violence against women and girls is to recognise that disproportionality and the fact that that's really in society-wide beliefs about gender roles and masculinity. And actually, if we just think about those societal norms for a second, a really robust response to violence against women and girls to prevent male victims of the abuse types under that umbrella by giving them specialist support that they need, who face very different barriers to getting support to female victims of different forms of violence against women and girls, but also a really effective response which starts, at a really young age to look at harmful ideas about masculinity that can have really negative impacts on men's mental health, self-image, relationships. That can have a really positive impact on men and boys too. So whilst we say violence against women and girls, we are talking about everybody, every gender, because violence against women and girls is really rooted in a lot of long-standing society. So, as I mentioned, we need to make sure that when we are looking at the forms of abuse that come under violence against women and girls, that we are providing specialist support and pathways to all of the different groups that will face additional barriers to support. So that is men, of course, but older people, younger people, those from the LGBTQ+ community. But each of those groups, the boundaries look slightly different. So it's no different when we are talking about men's victims of people. We're thinking about co-producing those services to make sure that those barriers are where we can get them, we can live with them. So my last slide is on commission support and funding. As I mentioned, we work in partnership with a number of different agencies, and a lot of our services are already funded with other organisations across Hertfordshire. What I will do is first talk you through it says that we have to commission under the Domestic Abuse Act, our statute, and then I'll talk to you about that wider services, that recognition of how much domestic abuse is in the community, and that needs to go beyond the support with safe accommodation. So our first service, arguably one of our biggest services, is provision of support in safe accommodation. We receive funding from the Department of Developing Housing and Communities on an annual basis to provide this support as part of our duty, and we commission Safe Places to provide that, and the annual contract cost is up there on the screen. With that same funding, we also commission housing navigators. So whilst we commission safe accommodation, which includes 64 units of refuge space, that includes what you think of as communal refuge space, but also dispersed accommodation, individual flats, house units in the community. We know that a lot of it's going to wish to remain in their own home, and that can be really, really, really tricky. For lots of different reasons, and they're different compared to whether you're in the private sector renting, or your own property, or whether you're in a housing association property. So housing navigators can help navigate those really complex levels of, housing associations, different organisations involved in making sure someone remains safe in their own home. And in that same vein, we also provide flexible funding to providers, and the dedicated part of funding that any specialist domestic abuse service provider can access to enable victims to flee abuse or to be safe in their own home. So we use that for things. It can be as small as train tickets, fleet counselling, but it can also be things like removals costs, or it can be wire goods for a property so that a victim can, has that kind of means to move out. It can be replacing lots of stolen documents, so they are stolen as a form of abuse and economic control. So this is an incredibly well utilised fund, and the idea is it removes a lot of that red tape around trying to access. And finally, we also use that funding to fund our independent co-production planning, to pay for the independent moderated chair, but also to reimburse the members of that panel for their time. We know that is good practice in terms of co-production, but it also just makes good sense of giving us their time, and having to think about their own trauma again. So we want to really recognise the value placed on their time. In terms of community support, we jointly fund the Hertfordshire Independent Domestic Violence Advocacy Service, which provides one-to-one support for victims at high risk of serious harm alongside in the community. This is a contract that has existed in Hertfordshire in various forms since 2016, and we jointly fund that with the Crime Commissioner and the Hearts and Onset Integrated Care Board. We split up the cost of the A new service that's launched in 2022 is our community outreach service, and this followed a motion to council to make sure that we are providing support not just for those at the highest level of risk, which is what our service does and what a lot of our population service does. But there is a real gap, and if you think about prevention, it's important that we support people before that level of risk escalates to the highest possible point. So we now provide a community outreach service, which supports victims that stand at immediate risk of harm, to make sure that we are supporting them at the earliest possible opportunity to stop that risk from getting any worse. This next bit I'm particularly proud of our grassroots service. It hasn't actually launched yet. We are working with Past Community Foundation to identify vulnerable services and grassroots organisations that are working with some of those groups that I mentioned face additional barriers to getting to older young people. Because we know that those services need to be designed with those people in mind. So our county-wide services are there fantastic, and they are brilliant at considering different needs of individuals. But we know that we need to be working with those vulnerable organisations that really understand those communities, to design those services and make sure that they're getting support that they need. We're also putting funding into risk management, and some of you may have heard about recently the Petitions Centre, which is working with perpetrators to change their behaviour or to bring in criminal justice measures where that is needed, because we know that we want to prevent abuse from happening in that space as much as we can, and particularly with the benefit and very well perpetrators of abuse. And finally, this is technically a statutory area of provision. Community safety partnerships are required to conduct domestic homicide reviews when someone has or appears to have died as a result of domestic abuse, and that can include suicide. So our team with adult care services coordinate so a lot of that. Some of our staff will go into that. And then each district environment council across the county also contributes funding for payment of independent specialist chairs. So that is a very high level way of doing our services. I can just see my colleague Helen.
Thank you, Katie. I just very briefly wanted members to be aware on the governance structure, the Domestic Abuse Executive Board is now going to be reporting up to the Health and Wellbeing Board. And and we're in conversations with multi-agency members in terms of a structure about the expectations of that across a number of different sub-boards, domestic abuse and VAWC exec being one, but it's certainly in terms of updates, endorsing the agenda and having wider conversations around continued and sustained funding. Thank you.
Thank you both. I think Colin starts out much how important this work is and how it is what these services that help people in these difficult situations and prevention part as well. So, members, I've got Nigel and I guess Nigel.
Thank you, Chair. Thank you for the report. And obviously, many patients. And clearly, it's very important subject. You mentioned community outreach, and obviously you mentioned grassroots. I think that you said that, but I think it's right here, fully funded by the county, aren't they? So that's important that they're kept going and be at least funded now and everything really needs. It's very, very important to see that, how that progresses. And I've written a few other things down. That's all right, Chair. I mean, it's looking at what more does. One of the things they talked about is in the future you have 5-6 strong representation voices from victims, and also lower down also 4, 5, 8 more a wider and more diverse and inclusive collective voice. But clearly that means across demography, ethnic minorities, etc. So I hope that is happening now. And also, as I said, all about the people with a lived experience. So it's all very well having, and it's very important reading this and then understanding that all the different groups and you're reading through all that, in the end, it's about trying to, you know what I mean, and everything else. You just have a happen through all this, you get the results, so we could have and we did the different groups. And there's another subgroup, this is another one that's got to this one. Well, I just hope you get there. But you just explain about probably a bit more about community outreach as well, but also making sure we have a proper diverse representation on the various groups.
Yes, absolutely. So yes, I can confirm that the community outreach service and the grassroots provision is under priority. We are evaluating both of those bits, what we're evaluating onto any service that we commission, but what we're always seeking to do, and particularly through our conversations with health and wellbeing, what we're now bringing into them is, demonstrating the efficacy of those services and identifying, have we got enough support being provided, and making sure that where possible we can fund services in partnership. So I would like to think that in a year or so's time, when we have the evaluations of those services, that we can look at, what has worked well, funding arrangements, and also work with our partners, perhaps, to expand the provision where that's necessary. In terms of representation, I'd like to just go back very briefly to our co-production panel. So when that panel was being established back in 2021, 2022, part of, as I mentioned, part of how we identified the people that wanted to be, contributing to developing services going forward was through that consultation that we ran. And we were very great. We had 42 people across Hertfordshire responded to that consultation, and part of that was collecting some of that demographic data so we can get understanding of what does the response start, what do you need to look like according to different protected characteristics. But that also meant that when we brought in our independent chair to establish that panel, it's up and running, is that they could look across the people that had volunteered and make sure that panel was really representative of the Hertfordshire population and the different groups that those voices were being heard. So at the moment, our panel is quite small and we're looking to expand it, but there is really good representation of different ethnicity, genders, and we've got a new independent chair, which will go through a process to identify a new chair, and then we're bringing in lots of national expertise from national domestic abuse charities like those, so that will help us to make sure that we've got that representation right. And then, yes, I appreciate the government structure around our strategy. It's big, definitely. what I would say is that, you know, especially part of the role of the executive or at the top of the structure, making sure that each subgroup has a very specific work plan that relates to their 4 strategic priorities in our domestic abuse strategy. So each of those subgroups will work to a specific priority and specific objectives under that, and we work with our public health colleagues to make sure that that is being delivered, and they support us with the evaluation and monitoring of that, because it is a lot of data we collect through our government structure to make sure everything is working. But yeah, and we run an annual public survey, just depends checks, touch base with the public, how we're doing, is what we're doing through strategy working for you. And then that again forms the plans for those groups. And I hope that answers the question.
Okay, thank you. Thank you, Nigel. Helen, you probably would have come in on, you would have come in on
Yeah,
that
no,
one.
thank you, Tony. It was about that particular point as well, just to add to Katie's response around co-production and how we ensure victims, survivors, people who've experienced domestic abuse in this county, as well as part of our monitoring. We have quite robust monitoring arrangements in terms of our service provision, and now that significantly includes listening, because as we know, not everybody wants to come forward, as Katie's highlighted, and be part of a specific panel. So there's different ways in which we would work to listen and gain people's views depending on where they are. So a lot of that is also supported by specialist providers within the settings. So we also do quite a lot of that and ensure that our service is informed going forward by what they tell us. Thank you.
Thank you, Nigel. I've got Fiona next.
Thank you, Chairman. On paragraph 4.9.2, referring to risk management development, interventions for perpetrators. The interventions that we're using, what evidence base is there effective?
Yeah, it's a very good question, particularly in the context of working with perpetrators of abuse. There is limited evidence for a lot of interventions to target and manage perpetrators of abuse. What we are seeing though is an increasing number of evaluations coming out from national organisations around what is effective, and what we know is particularly effective is a process called MATAC, which stands for Multi-Agency Tasking Coordination, and that is a process that tackles, looks to identify and intervene with the perpetrators that are posing the highest level of risk, so serial perpetrators, and those who are perpetrating particularly harmful forms of abuse. So the funding that we currently put into risk management goes to the Office of the Police and Crime Commissioner, and they are coordinating the MATAC process at the county, and therefore in the University of Hertfordshire to support with an evaluation of that to make sure that that works.
Thank you. What partnership do you have with alcohol and drug agencies in this?
So they are part of a program board that's been established by the Office of the Police and Crime Commissioner to get this. This is a very new area of work for Hertfordshire. You know, we've had a long history of providing support to victims, but you know, creating an evidence base and what works for perpetrators is really tricky. So they form part of that board, and then we are also exploring within our own government structures, you know, getting that engagement with colleagues across drug and alcohol. And to add on that.
No, I think in terms of the Chrysalis Centre, as you've outlined, Katie, that is led. We are critical members of that board alongside Children's Services, public health colleagues as well. On the other aspect of the team work is around the homelessness and multiple disadvantage agenda that also includes people experiencing domestic abuse and with drug and alcohol use, mental health. So it's a wider aspect of the team in relation to that work. So it's a key area for us in terms of that network of organisations.
Thank you. Is that okay?
That's fine, thank you.
Thank you. I've got Chris Lloyd now.
Yeah, Chair, if I can request that Helen can answer my question, because I can hear her more clearly, as I'm sure she can hear me more clearly than the others. thank you for the detailed report, which, as I say, I only read this morning. But I would encourage panel members, if you haven't read the detail, look at the scrutiny that we did last year. I would encourage all panel members to do that, and to also, my question to you, Helen, is what as county councillors can we do to support you? Because in Croxley, where I live, 2 people who I knew and socialised with, 2 couples at the same time, there was domestic abuse going on, and I was unaware until I was contacted by somebody else in the community who was then trying to help resolve that issue. So, people I thought I knew, yeah, I was totally unaware. So what can we do? What are the signs that I missed?
Well, I think it's really stark when you look at statistics around this, and 1 in 4 women, 1 in 6 men will experience some form of abuse in their lifetime. And in Hertfordshire, the numbers are in their tens of thousands. It takes up 20% of all police time is related to domestic abuse. And when we just sort of think about that, there will be people undoubtedly that we know that will have either experiencing or experienced. And certainly in relation to the county council, we have launched our domestic abuse policy for staff, which members may be aware of during the 16 days of activism back in November. And we have already seen from that a number of people either come forward. This is really a guide to help managers. And the most important thing really is to know where people can get help and support. So often we will take it on ourselves that we feel we missed something, we didn't do something, we should have done more. And I think what's so important is just the recognition that if somebody either discloses or there is something there that you think isn't right, it's about that recognition of the signs, which is where members have been so brilliant is in terms of the training and the awareness, and we will continue to do that through our Violence Against Women and Girls agenda so that people understand all forms of violence against women and girls. We're not the experts in this room. The experts are out there providing that support in the community through our funding. It's important that people get signposted and supported by those. It's impossible to know because it's so hidden. There's so much stigma, there's so much shame. And I think, the fact that you're even asking that question shows in itself that, that's something. Wearing the white ribbon, talking about it, and just being aware of where people can go to get that support is the most important thing.
Thank you. Happy there, Chris.
Yeah, thank you, Helen. There are some other questions, but if I may, I'd like to follow up offline, right, because I know you've got other members wanting to speak, Chair.
Thank you, Chris. I'm sure Helen or Katie can answer your questions offline as well. And Sally.
I'm going to try and speak straight into this microphone, so I actually hear you Helen really well. So first of all, just to say, and maybe I should have said this at the beginning, but I hadn't really made the connection, but my husband is the trustee of Save Lives. Now, Save Lives isn't mentioned in this report and it doesn't receive any money from Ross County Council, but I feel that I should mention it in this meeting. I welcome the report. I think it's fantastic. Thank you very much for the report, and I suppose more importantly, all the work that's been done, which is excellent and it's going in the right direction. And we all know, because we read in the news of the atrocious things that go on, and even today, obviously, there's the report for misogyny in the music industry. I guess that's no surprise. Sorry, I shouldn't say that, but anyway, it is daily that we get reports of this, and it is everywhere. So it's right that a light is shone. I just wanted to, there's a couple of things I wanted to say. One, domestic abuse is, and sort of the sort of ultimate taking of a life in extreme domestic abuse is kind of what very much gets the focus of life of attention, and it's quite a lot of what you talked about. But actually, the overarching thing that finally leads to, or not leads to, but is completely linked with domestic abuse is violence against women and girls. And my own I can't think that there's anyone in this room who is female who hasn't experienced it. but because it's not really been, because we've accepted it for so long, what actually has become apparent is that the people who basically perpetrate, relatively minor violence against women and girls in the community turn out often to be the people who are abusers in their own home. So the answer, Chris, to you and your neighbour is perhaps those people in the workplace haven't always behaved as well as they might have done. And if there was a workplace way of bringing that forward, then people might have questioned some of their behaviours. I think it's incredibly important that we show leadership in this as a county council. Now, I was one of the people that brought a motion to council, and I can't actually remember how long ago it was, but Tony, you were not the chair of the committee, so it was a bit, and it got referred to the cabinet panel. And the motion actually asked the council, the leader of the council, to do a number of things, including writing to the Prime Minister, the Home Secretary, and the Police and Fire Commissioner. Now, all of those things were rejected. What actually was agreed in the end that £1 million would be allocated in the budget. And I'm going to come to asking about that because, as I said, it was a while ago. It's before the time, so it was back for when dates and I can't find the meeting. But I guess to say that I think, as I said, it's brilliant that these bits of money are being allocated. It's great for all these working things in place. But we do need to show leadership, and leadership can often just be being shown by actually people being prepared to stand up and say, this isn't acceptable. So I really hope that the council takes that on board going forward. In terms of the £1 million, I had understood that was going to be allocated quite some time ago. I can't see in this report how it's specifically allocated. I can see lots of amounts that are attributed to different things, but not the extra £1 million. So I'd just be interested to know kind of where that is and where it's happening. And I guess if I have a plea, it's that we get on and do this as soon as possible. It's brilliant that these things are going on, but actually it needs to be being delivered.
Thank you, Sally. Can I just have something quickly? I'll pass on to Chris, I think, in case it was coming. But yeah, I do remember a discussion that 2 years or more ago at this time I was in the portfolio holder then, but I did bring over a motion to the council as well about the domestic use and working with PTC and the money to do it. So I think it's important that we ask about the issue, we are working after this as a council. And then your comments are very good. I'll pass it to Chris and then that's great.
So just for the £1 million, that's currently in the budget. So those bits of expense, when Katie laid out really helpfully the different elements of that, that's still in there. We haven't put it as a separate £4 million in the sense it funds that overall activity, particularly where our programmes go over and above our narrower statutory duty, particularly around things like the preventative work, the grassroots work, the co-production work. And then even when we've gone further in terms of sort of volume of the statutory duty work, so that remains in the budget and is in that budget currently. So that's where you can see if a separate line of expenditure against it, but the overall budget is we're currently expanded from £1 million from what it was before that decision was made, and that money has to keep that in the next. Yeah, I think so.
Just to clarify, the spend of £1 million for use that's currently being used for the grassroots provision and the community outreach provision. So that's currently being spent. So very small amounts for sort of community-based awareness raising. As you said, it's that community element and making sure that we're reducing that stigma and promoting pathways in the community is a really important part of all of this. And I guess in terms of the council leadership, I'd just like to say that obviously over the last 2 years, particularly with the introduction of the County Council being a white women-accredited organisation, which we've recognised for our efforts to tackle violence against women and girls, and Chris chaired that group for us, and part of the domestic abuse policy introduction that Helen mentioned is a massive part of that, making sure our staff are supported, but also what we're doing as part of our time driven implementation plan, action plan against that is raising awareness across the whole organisation on what violence against women and girls is, why it's important, and how everybody has a part to play, whether you're in adult care services or environment or working in highways or something, because it's so deep rooted in our society, it's actually everything that we do. So that there really is some great work happening within the council, the commissioning now with it. And I think that was everything. I think I've been any two questions.
Thanks, Katie. I think Chris and Jackie was having, sorry.
Yeah, no, I just wanted to, I believe that we've just commissioned Save Lives to deliver production reports, production report facilitation. So I just wanted to make that point in terms of what I was saying at the beginning. It's not in terms of the debate. I just wanted to just clarify that. She can't really hear, so yeah. I'm coordinating messages. I was also wanted to know that.
We just know that.
Yeah, thank you.
No, sorry, Chris.
Yeah, it was echoing Kate's point about the domestic abuse policy. I know it's made earlier that councillors has for its own teams. We know sadly that has already been had to be used. Which I in a sense it's good that we have a clear policy and signposting support people. But of course, challenging to think that that's already had to have been applied. I just wanted to stress the importance of men taking a clear leadership role in this, and that's why the Violence Against Women and Girls group council has as chaired by myself, and the vice chair who was very active in this is Stephen Pillsworth, Chair of the Parliament. So really important. I think one thing we can think through, and it's related to a point that Chris Lawrence making a couple of fundamentals of made, is what we do about the leadership sort of issues around community leadership roles, but also as individuals that may get come across cases around domestic abuse and how we support you deal with that in the most effective way. We'll take that away from that.
Thanks, Chris. Any further comments or questions? No? Okay, so the recommendation is that the panel is asked to note and comment on the content of the report. Note the work of the Strategic Partnerships team in relation to domestic abuse and other forms of gender-based violence, and note the new services being commissioned to fill gaps in provision for victims and survivors of domestic abuse, using the £1 million budget allocated for this work by the County Council. All members happy to note that? Agree. Okay, that's unanimous. Thank you. Thank you for your presentations as well. So much. So moving on to item 5, and this is the Hertfordshire Home Improvement Agency Annual Report 22-23. I think it's the second time I'm here, so you're perhaps less nervous this time, but I'm not suggesting where we are. I'll let you go over. Sorry. Just but no, we bumped into it this morning that we just said that. So.
Terrified, right?
Over to you, Sabrina and Stephen.
Thank you, Chairman. Yes, I'm going to provide some support to Sabrina the queries. So just very briefly, as you said, Chairman, received a report last year on the Home Improvement Agency performance for the previous financial year. This is an update. It's for noting and for comment by members of the panel. It's not going onward up to Cabinet. The appendix provides the annual review for the financial year 22-23. Sabrina is going to go through that in a moment with a short presentation looking at activity and performance of the agency. And also, just to mention that members who also represent the borough district would be familiar with the work of the agency too, in terms of being a member authority. So I'm going to hand over to Sabrina now, who's going to give the panel a quick overview of 22-23.
So the Hertfordshire Home Improvement Agency is a shared service where we deliver the Disabled Facilities Grant on behalf of the district. We now have a new family member, as we like to call each other. So we this year we have St Albans joining us. We're on target actually to can spend 100% of their money this financial year in the first year. And I found out yesterday from a board member that they haven't achieved this for quite some time, so they're very pleased already with the results. So that was really good news for us yesterday at the board. So at the moment we're 6 districts. We're Stevenage, East Herts, North Herts, Broxbourne, St Albans, and not forgetting Watford. So just to give you some of the highlights from last year. So we completed 19% more adaptations than we did on the previous year. All targets that we achieved, we set last year, we maintained the previous year, we maintained this year. So we're pleased on the eligibility timescales, our customer satisfaction, installations, we've managed to maintain that. All high priorities, all children's high priorities, palliative cares, were all allocated to a caseworker in 24 hours longer. And we were really pleased to achieve that. So across the board, across the 5 districts, we were able to spend 100% of everyone's allocated yearly budget. For a number, and last year we completed a record number of discharge to assess cases. We appreciate the additional support we had from adult social care and the health integration team on that as well to achieve those results. And just to give you an idea of where the money goes, what is the kind of, where does most of it go on in terms of adaptations to help people remain independent at home? So we had 2 million spent on level access showers. It's actually taken over from stair lifts, used to be number 1, but level access showers now has taken over. Stair lifts at number 2, we spent nearly over £600,000 on that. And the new trend ever since after COVID has been ramp adaptations to allow access for clients to get out of their homes and into the local community. We spent over 300,000 on that. And then extensions, and that helps out a number of people. It's never just one person who we're helping. Usually extensions help a number of people in the home, and we spent over 200k in that area. We maintained to be able to a 90% in customer satisfaction last year again across the board, just in terms of remaining independent, increase their daily lives, what they thought of the service, all the way through. So we're really pleased with that. A client or a resident in this case, they can call directly into the HIA. So as soon as you obtain a referral, they get a letter within 7 working days, welcome them, they get a reference number, they can call in at any time directly to the HIA to get an update or anything that they need to know. So we're really proud of that. And of course, we've managed to maintain it this year, all our inspections, all our pre-starts. So we're very pleased with that. And then also just to make sure we do it, at the moment we've achieved 76% of contractors being locally based. And that's great for the local economy as well. But it's also about, the power of localism and contractors understanding properties, residents, everything that goes with that. So we're very pleased with that this year. And this is just to give you an idea of the difference that we can make to someone's home, and just not to their home, but to their life, just in terms of them being able to remain independent. So just wanted to share that. And then just in terms of the next step, to ensure that the HIA maintains its DFG quality standards. So that's a new thing that the foundations have brought in, which is the governing body, and they want to make sure that we're delivering our DFGs across the board. We've been lucky enough to use some of our examples, how we do our contractors, their checklist, they have to be DBS, our training that they must have, they sign up to our contract, our liabilities insurance, everything to go with it. And we want to widen our relationships and our opportunities with housing associations, our stakeholders, like public health and stuff, just to make sure, we want to pool our resources as we go on more and more. There's limited resources for everyone, so we want to make the most. And we also want to make sure that we can pool on everything to make the most, that our residents get the benefit out of everything possible. And then again, we just want to ensure that governance, resilience, business plans remain fit for purpose. The one thing that we haven't noticed is the more our foundation are solid, the better that we're able to supply our residents with. We've now got experienced members of staff who've been all trained up to trusted assessor or advanced benefits training, so that we can help as many people as we can, or signpost them where possible.
Thank you very much. All right, any questions? We've got Fiona before we go, yes, and then not.
Yeah. Thank you. I'm very familiar with this service and it's an invaluable service. It's good to see that there's additional residents, over 50% councils. Do you have any idea why the reluctance of the I4 is to join what's clearly an excellent service? Thank you for the presentation. I don't think there's a reluctance. We are having conversations. Obviously, I can't say who. I don't think there's a reluctance. It's just the case of that, you know, the HIA in the beginning was getting together. It was still new, and now we're quite established. So I think it's just about, you know, integrating that smoothly. It's not, you know, sometimes some districts want to just keep it very local, depending on what their need is. They might not have the same pressure on adaptations as say some of the other directorates. I mean, not directorates, but districts. So it just depends, but yeah, no, but we are in conversations. Obviously, I can't say who, but you know, but we are pleased to say seeing these yesterday as well. Thank you.
Great, that's quite good. Can you stop sharing your screens? Sorry, that's okay. I'm sorry, I've got Fiona Guest next in line.
Thank you, Chairman. Two questions. The first one is, how is the sale of facilities grant handled in those boroughs and districts that are not part of the HHIA?
First, so part of the answer to the previous question is some boroughs and districts have their own separate contractual arrangements with the people doing the actual works. So in essence, it ought to be very similar. And I think one of the advantages of Sabrina and the team is that there's a high degree of co-working with our housing occupational therapists, for example, that are co-located involved. And that's the real big difference, the added value. But if you're a resident and you make an application for a disabled facilities grant, you will use the occupational therapists in adult care services in the same way. You ought not to experience any difference other than we've got the caseworker approach that Sabrina's outlined. So we provide a bit more assistance in terms of benefits, home visits, helping the person through the journey of doing the application. But I'm very cautious not to be critical of those authorities that aren't in the partnership. Many of them have got long-standing relationship with the contractors. For example, they might be doing work and some stock as well.
Thank you. The second question refers to the timescale for development for adaptations required to facilitate hospital discharge. I see it as 100% 7-day average for approval to take place. What sort of timescale are we talking about for the works to be completed so someone can come home?
Obviously, it will depend on the work. So if it's a level access shower, generally we have kind of 14-day, 15-day average, which a job can be completed. If it's obviously extension, those can be timescales I don't like to put to. But generally, we can kind of, if it's a stair lift, if it's a straightforward stair lift, we have the companies that we work with quite closely. They have timescales that we put them on, so then we try and get them in quite quickly as well. But obviously, some are, you know, catered to the properties that they're in. But yes, so if that makes sense. So, but generally, a level access shower will take 14 days, depending on the client's. The client is different to their needs as well.
Starts Chris.
Thanks, Sharon. And this is where there's a number of services where our managing demand includes really rigorous prioritisation exercise. And, you know, someone doesn't join a list to wait for something just because they've called that day. We're looking at, are they in hospital? Is there a pressing need for that to be a little bit quicker based on the risk? I would also add that, and Steve's responsible for these services too, in terms of supporting hospital discharge, the provision of community equipment is also important, and not as involved as a disabled facilities grant, but things like, you know, stair rails or various toilet seats, all sorts of other community equipment. It's really important that that's delivered in a timely manner, and the team will work really hard in enhancing equipment services, which is jointly commissioned with the NHS to be responsive to that. And then this year, for the first time, we were able to, on critical bank holiday weekends where hospital sessions are particularly difficult, was able to run that service over that weekend and the bank holiday weekend, and there was good uptake of services when we did that, which was a positive. So I think a wider equipment offer as part of the answer to housing independence in terms of what we do.
That's fine, thank you. Answer my question in full.
Not sure. Yeah, thank you, Sharon. Thanks for the report. It seems to be going well. I mean, you know, don't remember in Watford, you know, you know, actually, well, we, as you say, the other four councils that aren't may not join, but you know, it's people. But no, it's interesting that obviously when I was first even before the county council, I was as a borough councillor, it was always the big issue that DFG, the amount of money and time. So it does make sense to join that like this. And I see that obviously the last year, it's all new money we used that has been done in the last 2 years in cases. It did concern me a bit, obviously, when you see that it's administered, obviously, it's the DFG, have the funding, it's funding by the influence government by the care fund. It's a bit of an issue concerned about the care fund. And obviously, each district borough is allocated that set amount according to the makeup of the borough district. But is there a concern about that? I mean, is that separate from what we did about the care fund?
It's a very good question, and I think picking up on Chris's point, so we have used some additional better care funding in terms of supporting that process of helping people leave hospital, be safe and well when they arrive home with Sabrina and the community equipment service doing deliveries and works to their property. So that in a way is a really good example of where we've been able to add some value. It's not really a lot of money, but in some of the member authorities, there's a real pressure, particularly to get towards the end of the financial year. So that it's helped us do more works than we otherwise would have done. The other, I think, real success of the last couple of years, I mean, there's a picture of the two teams together celebrating. You can't overemphasise how residents can often feel that they've got to go through lots of steps to get what is quite often something. You're in people's homes, it might be a very difficult time for them. So if we can do anything to reduce what we call our loss in the jargon, most of your constituents, most of the names or confusion about who's doing what, and that's absolutely fantastic outcome. Sabrina and the team are experts at doing that, trying to reduce that delay. So that's one of the other benefits of having overall view of better care as funding and agents using that term.
Again, Chris, would like to just a bit of reassurance on better care plan. So it comes through that mechanism, but it comes through as a ring fence grant about 8.3. Super things. 8.6 million last year. It comes through entirely ring fence. So although it sits within the better care fund, that's essentially a mechanism for that money coming into the council. We then divvy that out, as you said, based on those things. So it's not, for example, in play for wider discussions around the use of the better care fund. It's coming through that as a mechanism rather than coming through a pool for which we can have prioritised money against.
Thank you. Thank you, Mark. David.
Maybe I was record. I think you said that your schemes in 22-23 are 100% completed. Forgive me if I misread.
Oh no, they're 100% spent.
Right.
100% spent.
So it's been spent.
Yeah, so of the DFG allocated to each district.
It's spent. So therefore that's been the DFG has been completely allocated for this year. Now I understand there's a waiting list long run. I'd like to know, please, how long is that waiting list and how many people are on that waiting list waiting for elections and improvements. That's my first question.
You've been on the time, maybe just got an answer that when I come back to David.
Thank you.
If I'm honest, the waiting list does vary from district to district, just because we have to focus on the sorry. Yes, I apologise. It's a bit weird, it's not natural speaking at my anyway. If I'm honest, it does depend district to district, just because some of the districts have a higher demand. They could have, I'm guessing, David, you are from North Arts. Yeah, yeah. The waiting list, unfortunately, for North Arts is slightly longer than it is for the others, just because of demand. So, just to give you an example, for every one referral that comes in from one of the other districts, 5 come in for North Arts. It's just the way the demand is, and obviously we have an allocated pot each year. So, unfortunately, for North Arts, it is slightly longer than I'd like to say. I wouldn't like to give a number at this point because I don't know the exact number as of today, but I'm happy to find that out and give that back to you, David. But generally, once you've been allocated, we do try and get you through the process as quickly as possible. We do make sure that we do meet the kind of guidelines that are suggested by DFG, so we make sure that everyone knows that they're eligible within 6 months. You know, if before that, that's the longest that some people know whether or not they can apply for a grant. We try and get that through, processes through as quick as we can. One of the advantages that we have is that we're a dedicated service, so we do try and make sure that the client does get through the process as quick as possible.
Sorry, no, yeah.
Yeah, Chair. Thank you. Each district presumably produces a fund for does that vary from district to district? And the question there is, if one district is given a higher contribution towards that, does that give their constituents a priority over another distributing? I'm saying we wouldn't put a shower within 14, 15 days. I know that need has been identified, and the deposit payments have been paid, and the answer that comes back is, well, we've run out of money for this year and we'll try and look at it later on. We'll let you know when we can. Is that good?
So just in answer to your other question, each district does get a different allocation. It's not done by HTC or anything. The government allocate a certain amount for each district, and we have to use that. And there's no sharing between the districts either. They keep to their own money. So we don't kind of make a priority thing. Priority is already there before we even, and we try and then we look at that need. If you're a high priority, obviously we'll try and get through to you. It's not that we wouldn't, you know, especially for North Arts, we have looked at that. And at the moment, we are looking to work with our partners with that. We're hoping to sign kind of a deal at the moment to help us with the North Arts situation. Obviously, I can't say too much because the ink isn't dry on the paper, but we are looking to work with our partners in order to help that. It's not that the funding's there. It's just that we have to try and make sure that we make the most of it, use it productively, and make sure that we get people through the system. It's just, you know, particularly of North Arts district.
Just one last.
Yeah.
What we're saying then is that the allocation, let us say, for North Arts, and forgive me for targeting that particular areas, has been spent, and therefore any more management is not going to be coming in until after April. The working list for that would then be starting to go down to somebody who had an expectation and paid a considerable sum of money last year, would only just be in the new year going along as the list goes down, and they may be halfway down the list, so there could be a considerable.
I think Chris.
In terms of specifics, I don't want to answer about a specific case here, obviously the issue around analytics and so forth, but what we'll do we'll go away and have a look at that specific case, maybe around what you mentioned around the deposit and so forth. We'll go back with the team to look at that. I mean, ultimately, yes, the money that we get from government is finite, and that has to be used as and that will not meet the level of demand in a given area. That will just depend, and that's the same with any of our demand-led budgets. Ultimately, and I'd stress across any areas in adult care services or with partial arrangements such as this, where we have waiting lists, ultimately you look to minimise those where we can, where we can't. What's important is the robustness of the prioritisation process that we apply to ensure that people at highest risk get the service in a timely way. Is that timely we always want? Not necessarily, but it's important that those principles of prioritisation are applied consistently to address some of those issues that you've raised.
Thank you for the answer, and thank you.
Thank you, David. Thanks for those answers. I've still got a few on the list, and the next one's Chris. We haven't got any Chris over there.
No problem at all. Some of the questions I wanted to ask, thank you to other members, they've already asked them, so I won't ask them again. But if I can come back on the last point that you made, Chris, where obviously particularly in some areas, we've got more people than there is resource. So let's assume you'd allocated me X, and something came in for Nigel, which was a higher priority. He needed something installed. If you'd already committed that I was going to get something, would I still get it? Whereas if I'd come in after Nigel because he was a higher priority, I might not have got it. Do you understand the question?
Yeah, I do, and I'll make no comment about whether I prioritise Nigel or you, Chris. All members of the county council are valued colleagues, and I work for you. Once we've made a commitment to someone, we've made that commitment, and that holds. And it is challenging. We'll face that across all our budgets. You manage the budget on an annual basis and on a 3-year basis. And you're never sure what's necessarily going to come through the door in the last quarter of the year, and we have to make really difficult decisions about how we manage budgets. What we do is look at historical patterns and look at what our position might be at the end of month 6 and where that leaves us for the rest of the year based on existing commitments and so forth. So we look to work as flexibly as possible on that, but once a commitment is made, that is never unmade, is my understanding. Steve may have that also.
Just to add to that, the government's done a big large-scale review of DFGs a couple of years ago. And having done that, it came up with the view that it wasn't going to change anything. I think now there is a bit of a groundswell of opinion that local authorities that aren't spending, this isn't us, obviously, as Sabrina's pointed out, may come under closer scrutiny. Those local authorities that can spend efficiently and prove that there's demand may well get recognition of that going forward. We wait to see what will happen on that front. I mean, Sabrina has been very modest, because one thing we've done in North Hertfordshire is work very closely with the Major Housing Association, who contribute considerable sum to works for their tenants. So that's one way of trying to mitigate, your concern and the problem that members are hinting at towards the end of the financial year. The other is, as I say, we've been able to use a bit of the Better Care Fund as well, in addition to the Better Grant, where that supports people leaving hospital. So without wanting to overemphasise how innovative we've been, all those kinds of things, you would not be able to find, I'm confident, in many authorities. So I'm very happy with the way it's turned out.
Are you happy, Chris, with that?
Yeah, thank you very much, Chairman. I have a separate question that I'll ask Chris outside of a meeting rather than delay you now. So that's fine.
Okay, thank you very much. Calvin.
Thank you. Yeah, a lot of what I was going to ask is also been said, and I think what is really pleasing in this report is that we have spent 100%. And what was of slight concern to me was that we were saying that St Albans in the past hadn't, and now it was, which is really good. And so there is a bit of concern. I know we talked about concern about ensuring that I don't know whether there is any way that we can know whether other districts within the county are actually spending or not. I don't know whether that's really confirmed. So maybe that's one question. The main question would relate to the agency fees. I know from the report that they are covered by the Sustainable Facilities Grant. So there's often no cost to the client. I'm assuming that where there is a cost to the client, that is because it's taken into the means testing calculations. But the question that I got is whether we have benchmarked our agency fees and how they compare to others, whether it's any good work to be done on that.
Yes, so actually we have to advertise our agency fees on the national website, and actually we become quite low. So there are some that are charging 50% fees, 60, and some obviously won't name any districts, but yes, so we're quite competitive at the moment. So yeah, and we don't look to change that 15%. Yeah. I mean, there's obviously some that are slightly lower, but generally speaking, we're actually quite low for our fee we charge in comparison to most of the other HIAs. To all the companies that do disabled facilities well.
That answer your question.
Thank you. That does answer my question. It shows that actually the HEP is going further in terms of work that's being done on people's homes and ensuring that they're independent and perhaps there's other ones. So that's even more good news. Thank you.
Very good news. Thank you. Sally.
Yeah, yes, thank you. A lot of my questions have been answered. I still don't fully understand. Can I just come back to when you say it's 100% allocated, the boroughs and districts that are not under, that are not part of the agreement, I think Calvin asked this question. How do they account that to you for that money? I don't think so. And if they don't spend it, what happens to it?
I think the rules are so complicated within the capital finance letter that we get from central government, but in effect it's rolled forward. I think the discussion has been in Whitehall the extent to which that should be permissible. And so I'm loath to be critical of the four authorities in Hertfordshire that are members of the HIA, because spend, as Sabrina's pointed out, does depend on mix of the jobs, just operational issues, staff absences, and also the fact that they may have high commitment from previous financial years. So there are a couple of things that might impact how local authority spends its CFG.
I just want to say, make one other comment. Yeah, so thank you for that. Sorry for labouring that point and trying to really understand it. But the other thing I wanted to say was that you mentioned that 76% locally based contractors, which obviously is very good, but that still leaves 25% that come from somewhere else. Is there a policy? Maybe it's a question of being sorry to do everything to make sure that we will be focused locally.
To be honest, so we try and use as many local contractors as we, but unfortunately there are specialist equipment that needs to be, so specialist hoists, baths, or even stairlifts. Although we're lucky that we have a company actually that does really good stairlifts locally in Hertfordshire. Obviously won't say the name, wouldn't be to advertise, but there are some stairlifts that need to be specialists for whatever reason, and then we do need to go to outside companies for that. So it's not like we always try to make sure that, it's Hertfordshire based, but unfortunately it is the disabled, I think, so some more specialist equipment we need to go with, especially for children.
I've got one last Michael, and anyone else after, let me know, like, I'm going to just written down Michael.
It's not working.
Sorry, Michael, I was the same. I was like trying to see.
What's going on? Really? I'd like to thank you and your staff. I have a disabled daughter, and last year a scale lift was fitted to North Herts, well, no, it's settled now, Housing Association, and she was really, really pleased with the outcome and how easy it was for the staff to fit it, and it's made a hell of a difference to her life within the house. Thank you. And will you thank you, team?
Yes, of course.
Thank you, Mark. Nothing like a really positive story indeed today. So I assume there's no further questions from anybody. Thank you, Sabrina. Thank you, Stephen. So we're asked to note and comment on the contents of this report as Kennedy's which we've been doing. I assume everyone's happy to note that. Okay. So that's the last item of business, but I'm just going to come back to an update on the production about the Sundays.
Yeah, sorry, two things. Sorry, I need to correct myself. Again, Chris was correct.
What did also?
The disabled facilities one is a instrument. Feel like now right. And the other thing to say is, would it be possible for us to have the slides presentation before, which not really in that would be slides that
Also, thanks for asking this. That's fine. So just with that there from Chris, I think he's got a little bit of information.
Yes, I think there'll be reference to the decision about whatever share of the national monies we receive in the cabinet paper and the integrated plan, which will then form our recommendations to the council. So to answer your question, we can confirm yes, that information will be presented before council and will form therefore part of the wider discussion of the integrated plan. So that will then be a discussion with all parties available at that time, committed or proposed to be convened in certain way of discussion.
Thank you, Chris. That's the last of the meeting. So I'll prepare a close, but just to remind people the next meeting is Monday, So thank you everyone for a really good discussion. Thank you.
Yeah.
Thank you, Chairman.
Thank you, Chris.